Hello, everybody. I'm Dr. Sita from Ojas Aesthetic, esthetician and cosmetic gynecologist from Ojas Aesthetic, Hyderabad, situated in Madhapur. So, many people ask me about hair growths, their hair related queries, and what we should do. Many times I see patients of all ages coming to me for hair related problems. Now, why do the problems occur and in what ages do the problems occur? Let us analyze the situations and their treatments. Most often, there are two types of hair loss. That is, one, due to a nutritional or a mineral deficiency, and secondly, a genetic origin where they complain of hair loss at a very early age. Sometimes we get these complex situations where children of very young age also suffer from hair loss. When you analyze, you see that their nutritional deficiencies have been very much high and have not been corrected for a very long time. It could be from the prenatal position. That is, if a mother is deficient in certain nutrition and nutrients, it may be carried on to the after birth, and immediately the children may see a loss of hair, not a good regrowth even after the childhood is over, and then they do suffer from these nutritional deficiencies till the early teens. So when you analyze such situations, you have to carefully analyze their mineral blood work, especially their minerals, the vitamins, and other ingredients like enzymes, and the liver function test, which is hampering the nutrition and the uptake of iron or other vitamins from the intestinal tract. So when these are analyzed, you will be able to correct the deficiencies in a better way. Sometimes very rare liver diseases can be there, which can result in a total baldness or a kind of a hair loss, which is very typical of this condition. And there is not much to be done there. But apart from that, in a general population, when you see a nutritionally deficient child, you have to offer nutritional corrections. The same is true of women in childbearing age. Most of the time, there is an iron deficiency in women because women also suffer from their periodic loss of blood during their periods, and there is an iron loss. When the periods are very heavy, sometimes the nutritional deficiency still exists and it is not balanced, and this reflects in a hair fall. Therefore, when a woman presents to you with hair fall, it is always better to do the whole blood work. Let us not assume and jump to the conclusion that it could be some congenital origin of hair loss. When these are corrected, women can have a better, along with their lifestyle and better nutrients, they will have a good regrowth. A thumb rule for me is always to check the nutrition, to give a supplemental therapy for 3 months, and if still not resolving, then I do analyze the other treatments that are necessary for the child or for the man. It's also the same in men, but men present with a unique type of hair loss, which often happens in a very young age, and they can come to you at the early age, like 18, 19 years. They do suffer from hair loss. Here also, nutritional corrections are to be done, and they have to be counseled if they're doing or overdoing their hair care, especially the uh, stiffening kind of treatments, straightening kind of treatments, the environmental weather changes that are harsh to the thing, very hot treatments. These can actually damage the hair, and there could be a relative hair loss. Therefore, people have to be warned about excessive use of gels, creams, or hair straightening, hair conditioning products, which can damage their hair root, can result in a hair loss. If these are corrected, there could be a reversal in the hair growth. Apart from this, nutritional treatment also has to be given in a sequential way. Generally, we always, as a general practitioner, also many doctors do advise nutritional care, but the nutrients that are needed for hair regrowth are in very high, large amounts to be needed, and it has to be given in a sequential therapy. Now, what is this sequential therapy? Sequential therapy is giving the nutrients of a particular type and in a particular duration, and then repeating them again and again to get the desired amount. Most of the nutrients are most important ones would be the iron, the vitamins, the amino acids, especially the essential amino acids, the calcium also has to be given in the right quantity to help with the hair growth. Therefore, a 3 months duration of certain nutrients, then give a little break and then restart the nutrients to see that there is an effect in the hair regrowth. Many a times, sequential therapy has helped many clients to regrow their hair, and after a 6 months duration, you definitely see a regrowth and a hair thickening and a better quality of the hair, if not the total growth. So this will help us to ascertain that the condition can be reversed to a certain extent. The other type of hair loss that people get worried about is also a nutritional pattern of hair loss when the woman is pregnant. So in pregnancy, though the nutrients are very high, highly given to the women, most of the nutrients are utilized by the baby, and the women starts observing a hair loss condition, which is very, very drastic and very, very high quantities, high amounts of hair are lost immediately during the childbirth, or sometimes even in the late part of the pregnancy. So this woman alarmingly comes to us telling that there's a complete hair fall and she's worried that she may lose the total hair fall. Counsel her, tell her that it may be due to the nutritional depletion that has happened during the pregnancy, and we will check and reverse the condition with only medications. Many people rush to start treatments at this point of time, but I would urge to see that the other nutrients are supplied first of all, and the treatment is delayed a little bit, because what can be done with nutrition, what miracles can be done with nutrition, sometimes treatments cannot offer the same results. Therefore, I strongly advocate the use of nutrition in the form of supplementation therapy. Either it could be oral therapy or sometimes even IV therapy can help to solve the problem. Glutathione, though a nutrient which is more popularly used for skin whitening or skin glow, is also an antioxidant that is helpful to improve the hair, or to supply the other vitamins, to act as an adjunct vitamin to supply other vitamins at the right position and as enzymatic actions. Therefore, I would also suggest a glutathione loaded IV drip along with other nutrients in people in people who want a better result and in a shorter time. So these will help to resolve a nutritional hair loss or a hair loss due to environmental conditions or depletion of the vitamins due to the stress related factors like pregnancy, maybe dieting, maybe excessive exposure to chemicals or other conditions. So when this kind of hair loss is dealt with, we also see hair loss in women that is due to pregnancy or due to stress, that is telogen effluent. Telogen effluent is a loss of hair in the anagen phase, that is in the growth phase. And you always see a picture of very short hair and not growing to its full length, or a lot of hair loss is very high. The ratio of hair loss is very high than the ratio of regrowth. In these conditions, also it is completely reversed with nutrition. If not, a PRP can be tried so that the enzymatic reaction can be hastened, and PRP in the form of in the with along with the sequential therapy will help to regrow the hair in these conditions. Very rarely, women also present with an early onset of androgenetic alopecia. That is called female pattern hair loss, because this happens in a different way from the men's hair loss. Either it is mostly frontal and it presents like a widening of the hair in the frontal region where women does the partition. So the partition area looks wider when noticed in the beginning. Then there is could be a thinning in the hair or a frontal patchy baldness. So these conditions have to be reanalyzed. A careful history has to be sorted out, whether there is any association in the parental or the near family members, and if so, and if there is any hormonal influences like the thyroid or early onset of menopause or the menopausal changes that the women is going through, have to be taken care into account. And then the other investigations, like in any other hair loss problem, has to be done. Apart from the investigations here, we have to counsel and explain the client that apart from supplementation, probably she will need a supportive treatment in the form of either the minoxidil supplementation or uh, in the form of serums, in the form of lotions, or even oral therapies. Or she can go for some innovative treatments that can help to resolve this problem of hair loss in androgenetic alopecia. Now, androgenetic alopecia in the initial stages can also be reversed with nutrition alone. This part is often neglected and the people come in later stages. So, if it cannot be corrected with nutritional supplementation, and minoxidil supplementation or lotion has to be added. Apart from that, we can try PRP for rejuvenation of the hair. PRP helps to improve the enzymatic reaction in the enzymatic reaction of the hair, and the nutrients are supplied in a better way. There is also DHA resistance will be lowered, and there can be regrowth. Apart from this, there is an innovative therapy for androgenetic alopecia in women, especially of this pattern, called the Regenera activa. Here, the regenerative mechanism is used in the form of billions of stem cells in the form of micronized patches are taken and transferred to the hair. But here, the lot of solutions are actually pulverized, and we take it in the form of a solution which has all the enzymes in it and injected along with the growth factors. There are a billion growth factors that can be injected into the hair, and this is a single sitting treatment. And most of the time, the client sees the growth around 3 months, and then we have to see and review the growth at the end of 6 months. A repeat treatment may not be necessary in 90% of the clients, but in some people where it's an advanced kind of androgenetic alopecia, this treatment can be repeated after 1 year. In between, the patient can resume her supplementation therapy, and we have seen a lot of positive results with Regenera activa. It is an ideal treatment for early onset of androgenetic alopecia, both in men and women. And in men, if it is not a very in men, it can also resolve the baldness in the frontal area, can cause thickening of the hair, and can be repeated after 1 year. Regenera activa can also be combined with other treatments which are very, very novel in the form of growth peptides or growth factors and exosomes. Exosomes are newer molecules. These are secreted by the stem cells when the stem cells are being excited, and these exosomes are extruded into the extracellular matrix. And the extracellular matrix is titrated and used by, because all the antigens have been removed, and it can be used as in any individual. It need not be autologous. It can be synthesized in the labs and is supplied in the form of a solution, which can be used in hair loss patterns. Exosomes can recruit lot of growth factors into the cell, and they will help the cell uptake the growth factors and use them for the regrowth. Therefore, you can see a lot of changes within a few weeks of giving the exosomes. Usually, exosomes are also injected, or they are done with the mesotherapy, so that they are absorbed into the scalp and utilized by the cells. So you observe changes around 2 to 3 weeks from the application of the exosomes. So exosomes can be used in weekly pattern or in a bi-weekly pattern till you get the results. There is no overload of stem cell factors here. There is no antigenicity in exosomes. Therefore, it has been a very, very useful tool in the hair regrowth. Then there are other patterns of baldness where they may not be amicable to these changes, and here patient has to be re-evaluated for other reasons. And if it is an advanced kind of a baldness, then a transplant has to be done. Therefore, a donor area has to be seen. If it's a good donor area and both the client and the doctor are aligned to this treatment, then they can go and have a transplantation done. So, before the onset of these problems, I would urge, what are the checklists that these people, any client for that matter, either healthy or in involved in some sickness have to be taken. A 3 monthly routine test to see that the vitamins are all in the normal range, especially the iron in women and other B complex vitamins, and regular supplementation in the form of supplements, uh, especially in the periods of stress. Either the stress of an exam or a stress of other environment can also cause depletion. Therefore, regular supplementation can also be helpful. Also, they need to check if they have a genetic history of hair loss and onset of baldness, and this can help them to come earlier for the treatments. The hair treatments are very, very rewarding, and they can be opted with a less time duration. We can give them a better results. So hair rejuvenation is an art and a science.